Pediatric doctors are treating adult patients and primary care doctors are struggling to make it with patients staying at home. The striking rarity of severe coronavirus disease in children has prompted an equally rare reshuffling of pediatric healthcare services. In some cities, hospital-based pediatricians are stepping in to help care for adult patients, while community pediatricians nationwide are watching their practices wither because parents fearful of contracting the virus in a doctor's waiting room are keeping their children home. Consider Mount Sinai Health System in New York, the biggest academic medical center in the heart of the pandemic, with 8 hospitals and more than 2,000 adult COVID-19 inpatients. Nearly a quarter of hospitalized adults have needed intensive care. Remarkably, fewer than 10 of Mount Sinai's hospitalized coronavirus patients so far have been children, says Dr. Robert Pass, Mount Sinai's chief of pediatric cardiology. One young patient needed ICU care but recovered after treatment. I consulted on some babies less than 2 months old who had mild pneumonia and were COVID-19 positive, Pass says. They're fine. With so few children needing inpatient hospital care, Pass says, many Mount Sinai pediatricians are helping to care for adults. They're filling in on the night shift in adult ICUs or working on step-down units for COVID-19 patients who no longer need intensive care. Almost every division of pediatrics at Mount Sinai has faculty who are taking care of adult patients, he says. In all cases, he says, pediatric specialists turned coronavirus team members work under supervision of doctors accustomed to treating adults. Nobody's very comfortable taking care of adults after many years of caring for children, but there's lots of online learning and people are getting up to speed rapidly, Pass says. The hospital also has drawn up a plan, if needed, to convert pediatric intensive care beds for adult use. Children's Hospital of Colorado, which has admitted fewer than 10 children for coronavirus, none of them seriously ill, is working to support other hospitals in the region by accepting referrals for pediatric and young adult patients, by running tests for symptomatic health workers and by addressing community mental health needs, says Dr. Daniel Hyman, the hospital's chief medical and patient safety officer. We are also the first hospital in Colorado and one of the first nationally to offer plasma from recovered patients to treat COVID-19, Hyman says, as part of an international research effort to see whether antibodies from the serum of COVID-19 survivors can blunt the impact of the virus. In the early stages of a pandemic with so many unknowns and cases continuing to mount, pivoting from pediatric to adult COVID-19 care might strike many policy makers and healthcare workers as a gamble. But Dr. Joseph Street-Gemme, physician-in-chief and chairman of pediatrics at Children's Hospital of Philadelphia, says that it would be counterproductive to prepare for an influx of young COVID-19 patients, given the clinical experience so far. We've had some patients admitted to the hospital but we're definitely not seeing severe disease, he says. Any resources that inappropriately go to a children's hospital will take away from adult facilities that are struggling now. St-Gemme adds that the majority of children's hospitals are part of adult systems that are likely to see an influx of COVID-19 cases. Even the true standalones are working with nearby adult hospitals, in some instances to take on cases in young adults that might otherwise have burdened an adult hospital, he says. Researchers say they are baffled about why the coronavirus hits adults harder than children. I have no clue, says Dr. Margaret R. McDonald, a leading virologist at the Rockefeller University in New York who studies the complex interplay between viruses and the organisms they infect. McDonald says it will likely take months or even years to answer the question because so little is known about the new coronavirus and how it causes disease. One possible explanation may be that children haven't been exposed to as many coronaviruses, which also cause the common cold, as older people. Those previous infections, she says, may set the stage for the immune storm seen in adults with severe coronavirus disease. Other theories abound, from the protective effects of tonsils, which were commonly removed in the 1950s leaving older people with diminished immunity, to the relative immaturity of children's immune systems. Some viruses, such as Epstein-Barr virus, which causes mononucleosis, cause silent infections early in life and then may suddenly erupt into illness, says Dr. George Miller, John Enders Professor of Pediatrics at Yale University. Even though they don't become severely ill, children may play an important role perpetuating the pandemic. They comprise almost a quarter of the U.S. population. They tend to mingle more closely than adults, and they're constantly trading respiratory viruses. Although data are lacking because such a small proportion of the population has been tested, it's likely that coronavirus is widespread in children who serve as a reservoir and spread it to others, says Miller of Yale. It would be an unusual respiratory virus if children weren't a reservoir, he says. The classical thing is they get infected in school or in a daycare center and bring it home. Paradoxically, the coronavirus pandemic is also having a big impact on primary care pediatricians, whose patients are canceling routine medical appointments for checkups and vaccines. The American Academy of Pediatrics on April 6 wrote to Secretary of Health and Human Services Alex Azar pleading for the federal government to boost Medicaid reimbursements, which cover the care for 36 million children, to help them survive a crisis that they say threatens viability of pediatric and other primary care providers. "I'm sitting here in my office, and I've seen 3 patients today," says Dr. Sarah Goza, of Fayetteville, Georgia, the Academy's president. Most pediatricians are seeing 20% to 30% of their normal number of patients. "We're having to furlough staff. We don't have money to pay the bills. I've never thought of myself as a business owner, but I have rent and light bills and staff who need to be paid." Missing child checkups and vaccinations could set the stage for a surge of other childhood ailments, Goza says. "If we don't get patients younger than 2 for vaccines, we could have epidemics of whooping cough, measles and meningitis, which I've never experienced. We're here to take care of asthmatics so they won't overwhelm hospitals, the diabetics who need care, the children with ADHD. We're missing touch points with kids at a really critical time for them," she adds. "There's stress at home, stress nobody's experienced in their lifetime. They're not around their friends, there are financial issues, they're not eating because they're not getting school meals. There are children with developmental issues. How do we reach out to those families?" Data from several sources align to indicate that children have so far been spared the brunt of the pandemic. For instance, the Centers for Disease Control and Prevention released data on Monday indicating that just 1.7% of the people who tested positive for coronavirus in the U.S. are children under 18 years of age. That's likely because only a handful of children develop symptoms pronounced enough to meet the strict requirements for testing, since tests are in short supply. "To me it means that there are likely far more infected but undetected children," says Dr. Philip Saul, professor of pediatrics at the West Virginia University School of Medicine. "It means that many more kids have less severe disease." The CDC data support that assessment. Only 6% of pediatric patients were hospitalized and only 3 died between February 12 and April 2, the period examined in the CDC report. That's a vanishingly small fraction of the thousands of people in the U.S. who have died since the start of the pandemic. A similar picture emerges from U.S. intensive care unit data provided by hospitals participating in a quality improvement consortium called Virtual Pediatric Systems LLC. The organization's COVID-19 dashboard indicates that, as of Wednesday, the 156 participating U.S. hospitals reported 80 pediatric ICU admissions of children 18 and under with 3 deaths. Hospitals in New York reported 42 admissions, the most of any state, and 2 deaths. New Jersey ranks second with 16 admissions and 0 deaths. 1 death occurred in Pennsylvania. Like every other COVID-19 statistic, the true case toll is likely somewhat higher, because of a time lag and gaps in reporting. The phenomenon isn't limited to the United States, says Mark Witeka, president and CEO of Children's Hospital Association in Washington, D.C. Critical care admissions and deaths in children are pretty low on 3 continents. As COVID-19 cases continue to mount, researchers concerned about the impact of pediatric cases on hospitalizations and ICUs are trying to project how many children may develop severe disease. In a study published Thursday in the Journal of Public Health Management and Practice, researchers used data from China and the U.S. to estimate how many children in the U.S. are likely infected with the virus and what proportion are likely to require advanced care. Based on statistical models, they estimated that, despite the low number of cases reported by the CDC, as of April 7, about 190,000 children in the U.S. were infected with the coronavirus but may not be showing severe symptoms and therefore may not have been tested. Based on those numbers, they calculate, based on current ICU data, that about 1 in 2,400 become critically ill. They also calculated the impact on hospitals of different infection scenarios. They estimate that if just 0.5% of all children become infected, approximately 370,991 will become severely ill and 109 will need intensive care. If 60%, or 44 million, children become infected, 106,000 will need hospitalization and 13,000 will need intensive care. In addition to estimating the impact of pediatric COVID-19 on the healthcare system, the analysis offers starkly contrasting possibilities of where the U.S. might end up. The more children who become infected, the bigger the reservoir of children who may infect others. "We're at a fork in the road," says the study's lead author, Elizabeth Barnett-Poddick, of the Women's Institute for Independent Social Enquiry. "The choices we make over the next few months will really matter." Even in the worst-case scenario, Saul says, if patients flow in over time, hospitals should be able to handle the burden. The U.S. currently has 5,100 pediatric intensive care beds. Children's hospitals also are equipped with isolation rooms to protect children with impaired immunity from infection. Saul says that the stay-at-home orders are likely to significantly limit the number of infections among children, reducing the burden on hospitals further. "Kids are subject to the same mitigation that adults are," he says. 60% is almost a doomsday event, but, given the numbers, it probably wouldn't be catastrophic.